Why do we need a geriatrician in our society? One of my friends asked, there are anesthetists, there are surgeons, there are physicians who can take care of the elderly people also. So why do we need a geriatrician? Is it necessary? Is it not a waste? No, no, no. They, though this is the age of specialists, actually there is almost a specialist for every organ. In such a case, why a geriatrician is necessary? No, it is necessary. Older patients differ in many, many ways from the young. Indeed, such distinctions underline the separate existence of geriatrics and as a medical specialty. They differ mainly because of diagnostic, therapeutic, and social problems. It is very difficult to make an early diagnosis in the elderly because of abnormal symptoms such as weakness or loss of appetite tend to be interpreted by them as symptoms of old age, which just need to be ignored. In reality, these symptoms may be due to the early onset of the disease process such as tuberculosis, diabetes, cancer, etc. So tuberculosis is very common in both the ends of the life, that is in the childhood and as well as the senior citizens. So it has to be considered every time. Because of this attitude, diseases may be missed and elders tend to suffer in silence. Atypical presentation of the diseases are quite common in old age. Elderly may suffer from the heart attack without pain. It is called silent heart attack, without pain in the chest. Whereas the younger people suffer for hours together with chest pain, perspiration, sweating, uh, and so many other associated things. They may have stomach ulcers, gallbladder complaints, or appendicitis without any abdominal pain. Hence, only a specialized physician like geriatrician can make an accurate diagnosis. So, the patient, elderly patient, may have a mental illness such as forgetfulness, amnesia, dementia, and then Parkinsonism, and many more things. Are medical things, medical diseases like heart attack or chest infection, abdominal infection, and so many. There may be cancer also, which is hiding somewhere in the chest or in the stomach, the abdomen, and or in the brain also. And it gives the clue to explore those diagnoses. And it may be functional because of the multiple arthritis. Maybe in the hip joint, maybe in the knee joint, or elsewhere. They may suffer from functional dependency. And the social problems also arise. Many people, there may not be a caretaker for the elderly patient. They may be issueless and may not have any close relatives to take care of the patients and their necessities. So that is a social problem. Having the wealth also causes a lot of problems. Enough wealth or more than enough wealth will uh, the close relatives often tend to grab it by many means. A problem is commonly arises in investigating the disease in the elderly is to identify what is normal and what is abnormal. So the results of the investigation should be systematically analyzed before arriving at a conclusion on the nature of the disease. Moreover, the treatment of the disease of in the elderly is as complicated as the diagnosis itself. So, the side effects of the drug are both the age and the number of the drugs prescribed. So, patients will suffer at least from four diseases. At least the healthy senior citizens also suffer from at least four diseases. The diagnosis of the atypical presentation of the disease. Atypical in the sense the heart attack may be a silent heart attack, no perspiration, no confusion, nothing. The patient suffers from heart attack and dies immediately. Many may be due to heart cardiac arrest. It is very difficult to diagnose multiple problems. If there are multiple problems, we will have to prioritize the uh, disease, which one to take first. So it may be he may be having some serious problem in the chest, but along with that, he may have a severe abdominal colic, abdominal pain. Which one you take the first? First, calm down the patient by treating an intravenous antispasmodic, which subside the disease and then go to the main disease. Then to interpret the investigation results properly is very important. To give accurate dosage of the drug because it is known the drug given to the elderly person may not be excreted fully as in the younger age group. So the active uh, part of the drugs was all accumulating in the body. So it is safe to give half the dose of the adult dose to the elderly patient. For total assessment of medical, physical, mental and social problems, a geriatrician should come into the picture and geriatricians are a must. Thank you very much. Thank you very much friends. Share it, subscribe it and like it. Jai Karnataka, Jai Hind.